there who's joining me for this week's live Facebook session. Today is a super exciting topic. We're going to talk about the link between hearing loss and its association with cognitive decline, dementia, Alzheimer's, really memory in general. As always, I'm Dr. Abby Connell, coming to you from Carolina Hearing Services in Charleston, South Carolina. The link between our whole brain hearing and having hearing loss has really become a hot topic in the past couple of years. For me professionally, I've been seeing a lot of these types of issues with people who have hearing loss, who also have diagnosed or are suspected of having memory loss, dementia, Alzheimer's, and even cognitive decline in general, which is typically just a function of aging. Something that I think a lot of people don't really recognize is that cognitive decline, dementia, Alzheimer's are not actually directly related to age. A lot of people think that just getting older means that our brains slow down a little bit, but that's not necessarily the case. And about 10 years ago, you may have recognized that there was a huge push for people to really exercise their brains. And some people rolled their eyes at that. Other people started sitting there thinking, oh my goodness, what can I possibly do to stimulate my brain? And if you have anyone in your family, or if even you yourself started buying Sudoku books, that was the biggest thing that people were talking about to really be able to exercise their brains. Now, with the advent of iPhones and Android phones, smartphones in general, with all these apps, we've got such incredible access now to not just things like doing number puzzles, crossword puzzles, etc. There's lots of actual apps that are specific to brain health, which is great, but I'm not sure that people always recognize why exactly we're doing that. And so it's very, very important to know that up to and even not just up to, but also exceeding a third of people with dementia and Alzheimer's, you could actually prevent almost a third to not quite half by preventable types of things, including treating your hearing loss. So I just want to reiterate that because I don't think I stated it very clearly. The majority of causes, not quite 50%, but about a third to a little bit closer to a half, 45% of diagnosed cases of dementia and Alzheimer's could have been prevented if several health and lifestyle factors were treated. So, from my perspective, we're going to talk about hearing loss. Hearing loss is one of the biggest issues that can actually treat and subsequently reduce your chances for developing dementia or Alzheimer's. There's several reasons for that. Kind of the blanket one that I will say, just to give kind of a big broad, if you remember nothing else from this week's Facebook Live and you want to talk to your family members, is that all of the disease processes that cause dementia, that cause Alzheimer's, and that typically cause cognitive decline of any kind come from dormant areas of the brain. I have this conversation on a daily basis with my patients. Any dormant area of the brain means that all of the little nerves that are responsible for transmitting hearing and sound to the brain, if you have hearing loss that's not being treated with hearing aids or some other assistive device that's appropriate for your hearing loss, you are literally leaving that area of your brain susceptible to being taken over by the disease processes that ultimately become dementia and Alzheimer's. So just by simply treating your hearing loss, wearing your hearing aids consistently every day during all waking hours is keeping those auditory nerves stimulated so that that area of the brain is not dormant, it's active, it's working, The hearing aids are picking up sound in the microphones, transmitting it through your outer, middle, and then inner ear, getting it to the millions of little hair cells that are in the ear, and then up the big auditory nerve up to the language and listening center of the brain. All of that happens just like that, and our brain then puts together that sound so that it has meaning. It's not like we're just hearing Charlie Brown's teacher going wah, 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 wah. It actually has specific meaning. And by being able to reduce the cognitive load that hearing loss presents is automatically going to reduce your risk for developing dementia or Alzheimer's. After I finish up the live, I will post within some of the comments a few references to some of my favorite resources where you can actually look up white papers and other research papers that talk very specifically about all of the data that is now out there to be able to back up what it is that I'm saying. So there is a physician who is an MD PhD. His name is Frank Lin, and he has a tremendous amount of research out there where he did a lot of studies looking at fMRIs in individuals who were already diagnosed with dementia or Alzheimer's, who started their hearing aid use after diagnosis. They also looked at individuals who were suspected to be starting on the cognitive decline range, who they started treating their hearing loss early on in the journey. And then they looked at the group of people who had been long-term hearing aid users long before they were ever diagnosed with dementia or Alzheimer's. And the fMRI studies, so fMRI, if you're not familiar, is a type of MRI, obviously, but it's called a functional MRI. So the individuals getting the fMRI are being tasked. So they are actually listening to an auditory stimulus so that the MRI can actually functionally look at what's happening in the brain when they are being tasked with listening and responding in one way, shape, or form. And it is remarkable to look at these studies and what's happening in the brain, in the auditory center of the brain specifically, for the patients who had long since been wearing hearing aids. Their auditory center of the brain was still functioning almost like a normal hearing person's. In direct correlation or complete opposite to the individuals who did not get treated with hearing aids until after they were diagnosed, it was almost impossible to see that the auditory system was still functioning for listening and responding. And that's something that clinically I see all the time. And for anyone out there who is watching live or listens to this after the fact, if you do have family members who are suffering from memory loss, dementia, Alzheimer's, any of those cognitive decline factors, you will likely find yourself wondering sometimes, are they not hearing me because they're not responding, or they have a little bit of a blank look in their face? Or is this the Alzheimer's or dementia? And it becomes very difficult to tell the difference. In respect to the people who are not diagnosed until after they have long since been wearing hearing aids, it becomes much more identifiable that it is in fact their Alzheimer's or dementia and not the hearing loss. So to reiterate, if you're treating your hearing loss before you're diagnosed or even starting to have that cognitive decline, dementia or Alzheimer's, you have a much greater chance of not developing it, or at the very least, not having the hearing nerves be taken over by those disease processes because they have continued to be stimulated, therefore they're never left dormant. So that's kind of a lot of talk. I'm going to try not to make you seasick as I take my iPad and go over to a little poster that I want to show you. So we're going to take a little walk over here. And what I'm going to do is I'm going to attempt to flip my camera here. Okay, so far so good. So what we're looking at here, sorry about the glare there, but this is a very large, confusing poster that specifically talks about the ear and the organs of hearing and balance. So I just want you to kind of look at that a little bit for a second. But what we're going to do is now I'm going to bring you a little bit closer, trying to keep this as steady as I can, because what I want you to look at is this area here. So this is a close-up view of what the membranes and little hair cells are. And what this particular poster portion is showing you is that those red hair cells, let's see if I can do this right here, they are not only connected to the membrane here at the bottom, which happens to be called the basilar membrane, but they are also making direct contact with the membrane above it, which is called the tectoral membrane. So what happens when sound comes into the ear is that those hair cells are moving back and forth. And you can see this arrow here. That's showing that when the sound is coming in, those hair cells are going to shear back and forth, and that's what sends the sound to the brain. When you have hearing loss, those hair cells don't necessarily just die and go away, but now they're bent over. So when the sound comes into the ear, they're not shearing back and forth, they're just hanging out. And they're not stimulated unless a sound gets so loud that it can get that up to the brain. But typically, most normal sounds, I'm gonna flip it back around, most normal sounds in our environment are not going to be presented loud enough to get that shearing to occur. So that's what the hearing aids are there to do. They are there to get your hearing system fully functioning again. So when you have untreated hearing loss, you've got all those little hair cells that are just hanging out like this. They're not getting sound to the brain. So all of those little millions of hair cells are now susceptible to being taken over by the disease process that causes dementia and Alzheimer's. So I honestly cannot tell you enough that when people feel like, well, I can hear, but I don't always understand, that typically is indicative of a hearing loss. Most often a high frequency hearing loss, but not always. So amongst the many, many reasons that I could talk to you for hours and hours about treating your hearing loss, it truly is for overall health and most importantly for brain health. Not only is hearing loss an isolating issue where people stop wanting to do the things that they enjoy doing because they're not really fully engaged in the conversation, some people might not mind that. But when you think about that friend or family member or even yourself who is struggling to hear and communicate, it's not just taking you out of doing social things and communicating with friends and family. It's actually vital to your overall health, your brain health, and most importantly, being able to likely prevent getting dementia and Alzheimer's in the future. For those of you that are super interested in all the scientific data, I'm going to post in the comments shortly after this live is completed some of the studies that Dr. Lin talks about in his fMRI studies. There's also a great article that I will post the reference to that was printed in, I think it was the New York Times. Hang on while I put my fun pink glasses on. Was in the Wall Street Journal back in February of 2019. It's called Hear Better, Think Better. So I'm going to also post the link to that because that's a really great resource. And I think that it's also one that is easily understandable from older individuals that might be reading it. The last reference that I'm going to present is actually a compilation of groups of people all throughout the world who met and really came up with this commission on aging and hearing loss and its link to dementia. So that one is going to be, that's through this group called the Lancet Commission. And that's where you'll find a lot of the specifics on not just the treating your hearing loss, but what some of the other environmental changes that you can make to also reduce your chances of developing Alzheimer's and dementia. So bottom line, hearing loss increases the cognitive load on the brain. Plain and simple, we do not want to reduce the cognitive load on the brain ever. So when we can treat our hearing loss, reduce that cognitive load on the brain, we're not only reducing our chances of developing dementia or Alzheimer's, but we're also keeping our brain healthy. And a healthy brain is a happy brain. For anyone who has additional questions or anything, I don't see any specific questions popping up on the live feed. As always, reach out to your hearing healthcare provider. If you don't have one, you can always come see me in the Charleston area. Carolina Hearing Services. We are also a division of Odd Practice Group. I am located in our Charleston, South Carolina office. Our direct office phone is 843-556-4327. You can always reach out to me to ask any questions or schedule an appointment. And if you even just have any questions in general, feel free to send a message through Facebook, or you can also reach out to me directly. My email address is aconnell, that's ACONNELL, @carolinahearing.com. Thanks so much for joining me today. I look forward to seeing all of you next Wednesday for our next Facebook Live. Thanks for watching. Have a great day.